Okay, so we're gonna do the AP humerus. This is gonna be one of the 2 times in this class that I allow you to have a lengthwise that is longer than 17, and I will tell you why momentarily. So for the AP humerus, it's a 14 by 17 lengthwise cassette. I usually, again, start this based on my height. So if it's a woman, I usually bring it just a little bit lower than my arm. If it's a man, I usually bring it to my arm or a little bit higher. It depends on my room prep. I'm gonna do her left for humerus AP, but I'm gonna do her right humerus for the lateral. That is because it is closer to me and it is a PA lateral. So don't get that confused when you're skilling. You're gonna be doing one and then you're gonna do you're gonna have to turn them PA and go to the other side for skill purposes. The third projection will probably be a neutral shoulder. So I'm just gonna start having her stand with her back against the board, and I'm just gonna have her go ahead and bring that palm out. One thing to keep in mind when you're doing the humerus is you want it to be as straight as possible. So I'm gonna bring it back, but I'm not gonna have it all the way back because having it all the way back is gonna foreshorten it. Okay, so I'm just gonna have her bring it down, take a step to your right, keep going, right there. I want this to be about mid-humerus. Now, if you'll notice, I don't have a lot of light up here, but I have a whole lot of light down here. So, I'm gonna bring it up. I'm not gonna go crazy, but I am gonna bring it up a little bit. Because this is her epicondyles. So, let me do this. I'm gonna have her bring her arm out a little bit more, which will ensure I get it. Rotate, because you want those epicondyles to be parallel to the IR. Good. So from here, I'm gonna mark. Obviously, she'd be shielded. Here's her humeral head. I'm gonna bring it up a little bit more. Here's her humeral head. From here, I'm gonna turn so that we are with the humerus. I'm gonna open it lengthwise because from here to here, it's 22 inches from diagonal to diagonal. And then I'm gonna collimate in crosswise. Again, I'm gonna have her go right here. She's straight. I don't have her arm resting back because that's gonna foreshorten the humerus. I have it just down. And then you want the epicondyles to be parallel to the IR as best as you can. Obviously with a patient, you don't wanna be like moving their arm around. So that, and then watch the marker. When I had her move right there, it got into the soft tissue got into the marker. So you wanna make sure that you don't do that. So that is your AP humerus. And then we're gonna go ahead and do the lateral so you can go ahead and relax the arm. I'm gonna go ahead and bring this back to normal, back to straight up and down. It'll be easier for me that way. I'm gonna have her turn around. I'm gonna use the right marker because I'm doing the right for the lateral. However, if you have a left, make sure you do the left. So for this, it's gonna be just like a scapular where I'm gonna have her place her right hand, palm, right up against her stomach. I'm gonna have her take a step to the left. And then I'm gonna have her put her shoulder and her whole body up against that IR and turn her body slightly. Pop that elbow out a little bit. If your patient can, you're gonna just have them pop it out a little bit and then take a baby step to the left. This is one where the arm should be flush against the IR, okay? And then I'm just gonna turn. Now, if you'll see, because I moved her, I'm gonna have to make an adjustment on my cassette. So I'm just gonna bring this up a little bit to make sure that I get that. And then I'm gonna turn it. And I'm gonna have her take a baby step back. Take a baby step back towards me. Right there, perfect. Mark. And that is good, we are golden. Here's the top of my cassette, here's the bottom of my cassette. I got the elbow joint and I got the humeral joint.